So you have EDS and you think you can't exercise? Oh, but let me show you why. In this systematic review, they are going to look at exercise and EDS, and look what I found. If you're new here and you don't know what EDS is a connective tissue disorder. EDS is Ehlers-Danlos syndrome, and it is characterized by the abnormal synthesis, think creation, or function of collagen, fibrillin, estrogen in the body, and typically affects the GI, cardiovascular, and musculoskeletal system. So these people might have gastroparesis, which means slow bowels. They might have heart issues like mitral valve prolapse, abdominal aneurysms, and their body is like a fainting goat and can collapse at any moment because they are like just bendy Stretch Armstrong. They go on to say that the prevalence is unknown, but EDS affects approximately 1 in 5,000 to 1 in 20,000 people worldwide. It can lead to recurrent joint dislocations and other injuries. We now have 13 different subtypes of EDS, with the most people being hypermobile EDS. Sadly, the 13th, the hypermobile EDS, does not have a genetic known marker yet, so because of that, many people don't get diagnosed. And if you think you have EDS, usually people are diagnosed by a geneticist or rheumatologist, even the geneticist at the area children's hospital. So they go on to explain that joint hypermobility directly results from deficiencies in the extracellular matrix, which leads to an increased connective tissue elasticity, so it's very stretchy, and this pathologic range of motion, meaning they overextend their joints way too far. This ultimately leads to subluxations, tendon ruptures. Exercise for people with EDS has traditionally included optimizing strength with improved muscle bulk, obviously, proprioception activity, so knowing where your body is in space, postural exercises such as lumbar spine stabilization, and trunk muscle endurance exercises. The idea is as we stabilize the abs, that the limbs are easier to move. What they don't specifically mention in this particular article is there are research studies that talk about that the lateral abdominals and the abdominal bulk in people with EDS are actually truly, literally thinner, and you really do have to work to gain your ab muscles. So they go on to say, while acknowledging exercise and rehab is an important piece of EDS care, the evolution of the diagnostic criteria and figuring this out has led to exercise and rehab studies that have heterogeneous populations. So the research is not pristine for EDS, but that's because we're finally learning about EDS, and we are going to get better with research for EDS. So one of the articles that they really enjoyed found that there was increased proprioception when people with EDS actually exercise. They are saying take that with caution because there is bias in the study. There's bias in all women's health or EDS studies usually because it's in its infancy. Overall, they're saying results show, yes, exercise helps EDS and it can have benefits earlier than 6 weeks because of proprioception.